For more on this, we're now joined by the Public Servants Association of South Africa, the Provincial Manager Mlungisi Ndlovu, to tell us more about this ongoing strike and the impact it has conducted on essential services. Mr. Ndlovu, thank you so much for your time this evening here on SABC News. I mean, just looking at that insert there and also just looking at the sheer impact this has conducted on such important and essential services to the eThekwini municipality. What is your take on the current strike and the major impact it has done on the public sector?
Good evening and good evening to the viewers. Obviously, as PSA in KwaZulu-Natal, we visited Inkosi Albert Luthuli today just to check the impact. And yesterday we were able to engage with the mayor of eThekwini because we're concerned that the central hospital like Inkosi Albert Luthuli will not have electricity for about 3 days. Theatre were not operating, some of the ward were not operating, some clinics were closed. But having to understand that is that we appeal to eThekwini employers to be able to engage, because when workers submit demand and you don't respond accordingly, your result is that you will have this type of crisis. Not only in Inkosi that has been affected. If you go to some of the clinics under Prince Mshini, some of the clinics has been affected. TVET College, V Campus has been affected. It's the impact. It is for these reasons that we believe that they should be able to go back to the negotiation. Obviously, the demand of workers will always be fair. If parties refuse to be able to engage, you will have this type of crisis. Department and employee can't operate without water and electricity. But we also call on the Department of Health to introduce more extra emergencies in place, ensure that they introduce solar system, because most of the hospitals are affected even by the load shedding. It is for these reasons we are saying the employer must be able to communicate more, because you cannot expect our members to go at work when some of the workers are on strike. The issue here is that parties that are in negotiation, they must be able to engage. If they don't engage, if they don't negotiate in good faith, it's affect service delivery. And we hope that the municipality is able to restore the water, but we are worried if the employees refusing to engage with workers and able to respond to their demand, because most of the workers are affected by the higher cost of living. Not only the municipality workers, even the public servants, we cannot be able to survive. Look at the resident at Inkosi Albert Luthuli. They had no power for about 3 days. They could not be able to cook, and some of their food were able to be spoiled and be destroyed. It is for this reason when we say the Department of Health, in particular the management, they must compensate for the resident, because there are doctors, there are nurses who stay in that resident. So we are saying there should be an action in terms of addressing some of these particular issues. Obviously, as PSA would always sympathize the workers with workers' demand, because we're also going to engage with some of the negotiation. Employer must respect collective bargaining, because if they refuse to engage, it's going to affect the society at large.
And Mr. Ndlovu, we know that Nahau has been right at the forefront of this strike in the eThekwini region. And as the PSA, are you also in support of this strike by some of your colleagues?
You know, as PSA, we are a trade union, and whenever workers are putting demand and the employer show the high level of arrogance, we'll always support them, because we believe that if employer are negotiating in good faith, they're not going to force the workers to be in the street. We are on the ticking bomb, because even the public servants, our chief negotiators, go to the table and you find that the employer are not willing to come on the party, because there are many challenges. As PSA, the answer is simple. Whenever the workers are on street, we sympathize with them, whether they are in the municipalities, whether they are in mining, because workers should not be able to suffer. That's why they could not be able to restore electricity during 72 hours, because there were no workers to be able to support. So employers must be able to understand that workers play a critical role, and taking actions against them, it's going to escalate issues only through engagement, because issues of human capital are very critical for any organization. We appeal to all the employers as we approach the public service negotiations, that they must come to the party, understand that the interest rate is high, fuel is high, workers cannot breathe anymore. We need to be able to take that into account, because if the employer was able to continue with the engagement, and they must also be careful in terms of what they are saying to the striking employee, only collective bargaining that will be able to resolve these issues. That's why most of the workers in the public service are choosing PSA, because we always ensure that we protect the right and the interest of workers. We must protect these workers so that we provide services. Look at us at Betlitude. For 72 hours, they were unable to operate more than 10 theaters, and some of the people have been waiting to be operated for more than 3 months. They assist not only the province, some of the people come outside the province. That's why we are saying issues of collective bargaining are very critical. We must be able to protect. As PSA, we want to make sure that our members are being able to defend it. So we are saying that the department must be more active in addressing issues that are unable to report for duty, and able to supply with water, because some of the facilities are closed down because of these basic needs.
Yeah, and would you say that it's fair, really, as we respect the strike by some of your colleagues in eThekwini? At the same time, is it really fair to compromise the health care of those patients who are needing that health care and those operations at the hospital?
It's a good question to ask, but it should be asked to the employer, because our members, as well said, they are ready to be able to work. If the municipalities are very arrogant in terms of dealing with issues, because we expect the city managers to respond to these issues. Obviously, as PSA, we want our people to have water, we want our people to have electricity, even these striking employees, because they've put demand in the employer's hand to say, let's deal with those fundamental issues. But if they decide to say, we are not prepared to take this matter further, it's going to escalate. And I understand that some of this process can be easily be hijacked by the criminals, because people take advantage of the situation. Do you want to blame the public servants or anyone who's on strike? No, but the chief negotiators must understand the rule. That's why they need to be very honest when they come to the table, not to be able to play a game. And we are calling for all the parties to go back on the negotiation and be considerate. They must be honest and treat employees, because the waste can't be collected in most of the hospitals, not only hospitals and other departments. If the waste cannot be collected, it shows that the workers have impact. As PSA in the province, it is for this reason to say employers must take us along, must be able to take us seriously, because if you cannot be able to negotiate, you have a problem. But if the municipality decide to say, we're not going to negotiate with you, obviously health facilities will be affected, society will be affected. PSA members are always ready to save the public 24/7. That's why even today, when water was restored, immediately they went back and able to address those issues. But we are saying we will not allow a situation where in resident our members stay in dark, they are unable to cook. How do you expect those people to go and save the hospital, which is our critical areas? We are saying employers must be able to work with all the organized labor, because we are not saying accept all our demand. We are saying let's engage, be reasonable, because you cannot deny something that workers believe that they should have been giving. There should be no unfair labor practice. We can't be wasting time to go into dispute resolution process. As PSA in the province, we really saying we must work together in addressing some of these fundamental issues.
All right, then, Mlungisi, thank you so much for your time this evening. That is Mlungisi Ndlovu. He is the KZN PSA manager there, just giving us their insight in terms of the strike action by municipal workers in the eThekwini Metro Municipality, and just basically the impact thereof on public health and how it has affected the Ngosi Albert Luthuli Hospital.